Okay. City of New Haven, Human Health and Human Services Committee, Wednesday, July 15th, 2020 at 6 p.m. And I am actually live in the Aldermanic Chamber this time. Board of Alders notice New Haven. The Health and Human Services Committee of the New Haven Board of Alders will hold a public hearing at 6:30 p.m. on Wednesday, July 15th via video conference at the following URL: webinar ID 970-6583-3638 or by phone at 646-558-8656 to hear and act on the following legislative items. For the password required, please email publictestimony@newhavenct.gov. Item 1, LM 2020-0235 resolution authorizing acceptance of an award worth $200,000 for staffing and supplies in the city's opioid overdose response program from Vital Strategies, Inc., for a coordinator to work with the community services administrator in establishing harm reduction strategies and a task force for the program. LM 2020-0246, resolution authorizing the mayor of the city of New Haven to apply and accept for the Navigator Grant Award from Access Health CT to provide community education and outreach of Access Health CT and to assist individuals with selecting and enrolling into a qualified health plan. Item 3, LM 2020-0249, resolution authorizing the mayor of the city of New Haven to apply for and accept a building local organizational capacity to respond to the COVID-19 in the amount of $100,000 from the National Association of County and City Health Officials to prevent the transmission of COVID-19 and to execute, acknowledge, implement, and deliver any and all documents as may be considered necessary or appropriate with respect thereto. Fourth item, LM 2020 from Alder Roth and Sabin, submitting an order calling for a workshop on local colleges and universities to return to school COVID-19 related planning and protocols. These items are on file and available for public inspection in the office of the city clerk, room 202, 200 Orange Street, New Haven, per Honorable Darrell J. Brackeen Jr., Chair attest, Honorable Michael B. Smart, City Clerk. For disability-related accommodations, please call 203-946-7833 voice or 203-946-8582 TTY prior to the meeting. If you wish to present testimony at this meeting, you may register in advance at the following URL that was provided, or by calling 203-946-7934 before 2 p.m. on the day of the meeting. Public comment and testimony may also be submitted via email to publictestimony@newhavenct.gov before 2 p.m. on the day of the meeting. Public can view the meeting at the following published URL, webinar ID 970-6583 3638 or by phone at 646-558-8656. And for the actual password, email publictestimony@newhavenct.gov. I will now introduce members of the committee first in the order that you are listed in your rankings. So our Alder Vice Chair, Ron Hurt. Alder Ellen Kupo, and Alder Eli Sabin. And we are joined this evening by our colleague, Alder Roth. Okay, we have quite a bit to go through, and I appreciate your time and your patience. We will begin with the items of the grants. But before we do so, I'm going to give my chairman's statement about protocol concerning grants. It is our fiduciary duty as alders appointed to this Health and Human Services Committee to vet, to know, to be aware, and approve of any and all grants being applied for, being thought of, or being received in order for us to be informed to our constituencies and to uphold our charter and our oath as elected officials. And we are indeed elected officials. And I will continue to uphold that fiduciary duty and that charge. And as all of you committee members know, I placed a heavy weight upon each and every one of you when you first joined, and actually Alder Roth, you were a part of our crew in the last term. This is the business that we were elected to do, and we will hereby do it at no matter what the cost might be. For members of the public, you may have seen an article that was published in the New Haven Independent. I can say on all the parts of city departments and this board that many of those statements were probably taken out of context and certainly did not cover what actually happened in terms of the business of this board. It is no way, shape, or form that this board would ever block a grant. I'll repeat that. There is no way, in any way, shape, or form, would any alder think in these times, in this chaos that we're all experiencing, to deny such funds. Let me be clear. These funds were applied for already. We are simply asking for a discussion, and that is what we will have on tonight. We will be cordial, we will be thoughtful, and we will do our job. Thank you. Now henceforth, now that we'll begin this meeting, I will ask my vice chair to please take note of the time of testimony, except for the invited guest, which would include city departments. We have a lot to get through. And also in terms of your questions, please be concise, and hopefully you all have come in advance notice with any questions or concerns that you might have, so that we might move forward in an expedited manner, because we do have a lot to go through. I believe our colleague Alder Winter will be joining us shortly. And is there anyone else that I'm missing? No. So we will begin with the Community Services Administrator in the Health Department. Please begin by stating your name and address for the record.
Marissa Bond, Director of Health, New Haven Health Department.
Good evening, Mehul Dalal, Community Services Administrator. I reside at 115 Linden Street.
And you may begin your testimony.
Okay, I'll begin my testimony on the first item. Honorable Chair, members of the committee, it's my pleasure to share with you an important opportunity to help New Haven address its opioid overdose crisis. The City of New Haven's Community Services Administration is partnering with Vital Strategies Overdose Prevention Program to establish an overdose prevention and response task force here in New Haven. Vital Strategies will provide the resources to hire a full-time employee who will be seconded to the CSA. They will also serve in an advisory capacity to support the city to expand harm reduction and overdose prevention services and supports. As members of the committee are aware, the City of New Haven has a relatively robust network of service providers and healthcare workers who specialize in caring for people who use substances. Connecticut decriminalized possession of injection drug treatment equipment and established syringe exchange access programs in 1990, one of the first states, and New Haven being one of the first localities to use this harm reduction approach. This embrace of harm reduction as an effective methodology preventing the spread of communicable disease and providing health services to the stigmatized population has assured the sustained reduction of new HIV diagnoses among people who inject drugs in the region. Further, statewide criminal justice reforms have contributed to reduce drug-related sentences and increase pathways for treatment for people who use drugs. Despite this focused public health and harm reduction response to drug use, overdose mortality rates and drug-related hospitalizations are increasing in the City of New Haven and across Connecticut. The present-day overdose crisis calls for an examination of existing health and human services in New Haven for people who use drugs to identify gaps and opportunities for creating and scaling up effective programs to mitigate this harm. In 2018, the City of New Haven organized a task force in response to a rash of overdoses in the city, most markedly ones that occurred on the New Haven Green. As a result of this task force work, the city was equipped with better tools to track overdose incidents and have more nimble programs to meet the need of people who are unhoused or otherwise unable to access services in traditional center-based settings. In 2020, the CSA intends to reconvene this task force with the goal of creating a harm reduction informed action plan to promote drug user health and decrease overdose mortality. Task force participation will expand to include grassroots harm reduction groups. The city wishes to identify the groups and the progress made since the previous convening of the task force. The task force coordinator, that is the subject of the funding from Vital Strategies, will work in partnership with CSA to identify stakeholders for participation, design an organizing structure for the task force, and establish a process for evaluating activities and outcomes. Participating stakeholders will be invited to share their expertise and analysis of the current landscape, particularly in response to COVID-19 and how things have changed due to that crisis. A bit about Vital Strategies. Vital Strategies is a global health nonprofit organization working domestically and internationally to help create strong public health systems that protect all people, including helping governments build solutions to pressing health problems. Vital Strategies has received funding for overdose prevention program to advance high-value evidence-based strategies that produce sustained reduction in drug overdose deaths and targeted in US states and localities. The overdose prevention program, technical assistance to state and local government agencies, and supports capacity building for community-based and institutional providers across sectors to catalyze and bring to scale health-based intervention to reduce drug-related morbidity and mortality. Under an agreement with the CSA, which has been initiated and under review, and with the approval of the board, Vital Strategies will fully fund the salary, benefits, and associated insurance and liability coverage for the proposed program coordinator position, as well as provide guidance, technical assistance, research support, and regular supervision to support the program coordinator in executing the responsibilities for this project. The City of New Haven will be responsible for day-to-day supervision and for the assignment of tasks and milestones that support the city's priorities. The city will also provide a physical workspace, currently planned as a virtual workspace, and the necessary equipment and software to perform the functions of the job, as well as resources for duty-related travel. Vital Strategies and CSA will work together to develop a detailed job description, publicly post and advertise the position, and select an individual with relevant experience to fill the role. The agreement will include all legally required protections for the confidentiality of any data or information associated with the project. Vital Strategies is able to provide up to $200,000 towards the payment of salary and fringe for the program coordinator. Vital Strategies has also agreed as necessary to cover the cost of supplies needed for the program. However, the City of New Haven will not receive any direct funds from Vital Strategies, but will receive the in-kind services of the organization. The duration of the program in the materials that were submitted to the committee indicated that 1 year of funding has secured between September 2020 and September 2021. However, in the interim between the submission of the materials and today, I'm happy to report that Vital Strategies has agreed to begin this resource as soon as a capable individual is identified for the role, and has indicated the interest to extend the time of this program to December of 2021. This will be pending approval on their side and their funding as well. However, they have indicated that this is the case. During this program period, we will look at various options to sustain the program beyond the commitment period of the funder, and the City of New Haven will remain in contact with Vital Strategies to help determine whether funding may extend it even further beyond what was committed. Thank you very much.
Thank you. Are there any questions from members of the committee? If there are, if you can indicate that by raising your hand on the screen or the, no, there's no raise hand feature. So just raise your hand. Vice Chair Hurd.
Thank you, Mr. Chair. Dr. Dalal, thank you for being here. I just want to know with this new road that's going to take place in our city, what area, if there is any, that they're going to specifically, what actually community, what area are they targeting?
The program is designed as a citywide program in terms of geographic area. However, we will certainly be focusing on areas that have higher incidence. We'll be looking at data to understand where the highest incidence of overdose incidents are occurring in the city. And our preliminary focus will be to try to address the most pressing issues in those high incidence areas.
Thank you, Mr. Chair.
Alder Kupo.
Thank you, Mr. Chair. Thank you, Dr. Joel. Was wondering if you could please provide a copy of the MOU.
Yes, that is still under review at the legal department. So I'm happy to provide that either a draft or upon signature, however you prefer.
I think both could be helpful. And then lastly, is the city providing anything in return for this this work that's going to be done in the form of either like clinical data sharing or anything other than that?
So there are existing programs within the city, including an opioid grant received by the health department. So there will be a concerted effort to ensure that data is shared across the relevant stakeholders. But if your question was related whether we're providing anything to Vital Strategies directly, no, but we are working directly with partners across the city, within city agencies and the key stakeholders and partners that work in the harm reduction space. And we'll be reviewing what data is appropriate to share with which stakeholders in order to implement effective programs.
Thank you, Mr. Chair.
And to staff, if we can just make sure we have a hard follow-up with the MOU and the details and the drafts and so on. Any other questions from members of the committee? Seeing none, item number 1 is done. So let's go to, we'll take testimony from item 2.
Good evening. Sorry, is it like testimony? Good evening. So I will be speaking on the second grant, the Navigator grant. The New Haven Health Department aims to advocate and ensure the health and well-being of New Haven residents. As you know, health coverage is a critical component to gaining access to healthcare. Based on our last census, 10% of the population lacked insurance. We were one of the original grantees in the past to have a Navigator grant. So we are pursuing this opportunity so that we can be able to ensure that when enrollment periods are open, we can have staff of 1.5 staff to be able to provide community outreach and engagement to ensuring that individuals can get access to healthcare coverage and then ultimately access to healthcare. We aim to partner with local community stakeholders and interdepartment programs that are active and ensure that we engage a citywide effort with enrollment. And so this is a 1-year grant period if funded. And so we're hoping that this will be awarded. And if awarded, it will allow us 1.5 FTE, and we will be able to also ensure that we can have this program again through our local efforts in the health department. Most of the grant funds of the $150,000 that we applied for will be primarily focused for community outreach, the salaries of the outreach workers. So it's going to provide the outreach and education and some funding strategies to support marketing and supplies. That concludes my overview of the Navigator grant.
Are there any questions from members of the committee on this item? Alder Kupo.
Thank you, Mr. Chair. Thank you, Director Bond. Can you just give some insight into, so will either of these employees be members of the city's union?
They will be union negotiated through the union, yes. So these positions are community health workers, and so that is a union position.
Excellent. And what will happen to these employees when the grant runs out?
So, as with any grant opportunity, we try to seek sustainability efforts. Sometimes because it's a community health worker standard grant, they may be able to focused on a different directive. It's a program initiative, but it does risk, that the position may end based on the grant period ending. However, we proactively try to seek grant opportunities. The same just happened with a previous community health worker in a different grant. That grant ended and we happened to start another grant. So now she just rolled into a different program. So we try our best to try to sustain our workforce.
Thank you. Thank you, Mr. Chair.
Any questions for members of the committee? Alder Winter.
Thank you, Mr. Chair. What are the goals in terms of increasing enrollment? What are we trying to accomplish, and over what time frame?
So during the fiscal, by June 30th, we want to increase awareness about Access Health TT to the general public. That's our first goal. Our second goal is to increase awareness of also the Medicaid and Husky eligibility populations and educate around Medicaid and Husky. Our third goal is also to work with our local food service establishments and food trucks and food carts and increase education to those vendors about the importance of healthcare coverage and the availability of the enrollment of Access Health TT. We also have another goal of working with at least 30 key stakeholders in the community that service different populations so that we can be able to increase enrollment. And then we also will continue with existing programs that we have on site as well, like our immunization program and asthma program that we have already that exists within our current structure. I'm not able to hear him. I can't hear you.
Hi, can you hear me?
I can hear you now.
Sorry, I muted myself. Are there goals for the number of people that enroll because of these efforts? Is there any way to track that, or is it really more about general awareness increases?
Oh no, absolutely. So we submitted with the submission of the grant specific metrics that we want to achieve with the specific vendors, with the specific residents, and the different stakeholders that we want to engage. So we have to have measurable outcomes when submitting these grant proposals. And so our goal is to increase enrollment and also increase the relationships with the stakeholders to engage them with Access Health CT information and referral processes.
Unmute Alder Winter.
I'm not able to hear him.
You mentioned engaging 30 stakeholder organizations.
Correct.
Is there also a numerical goal for the increase in enrollment, like hundreds or however many, or a percentage
So we have
increase over last year?
Yeah, so we want to increase at least 15 vendors, for example, with our third goal. With our second goal, we want to be able to increase awareness of the Husky eligibility. We want to engage at least 500 residents in the city. So we definitely have some ambitious goals, and we want to work with community stakeholders to get to those goals.
Thanks, Director Bond. Thank you, Mr. Chair.
No, thank you.
Any other questions from members of the committee? Or just alders? Okay. All right, we will move on to item number 3.
So item number 3 is another health department effort. As you know, the city of New Haven, and actually the entire world, was hit with a pandemic this past winter. And in an effort to respond, we created several public health interventions that consisted of pop-up testing sites, working with specialized groups and population serving agencies to ensure that individuals had the proper guidance in place to box in this pandemic. We identified a number of gaps while responding to this pandemic. And so in an effort to do that, we sought out a funding opportunity through the National Association of City and County Officials to create a COVID-19 task force that will allow us to engage these different sectors that provide services to vulnerable populations and to address some of the gaps. For example, the nursing homes and the high rate of mortality and cases that we saw that were disheartening to say the least. And so we want to be proactive. And so this grant opportunity will allow us to hire 2 part-time nurses to really facilitate and convene task force meetings with these different sectors and to really start planning and ahead before the next surge. Unfortunately, as you may know, we have 22 states currently that are experiencing their second wave of surge, and we are hoping we do not get one, but we want to be able to plan ahead and really start getting a plan in place. And so we want to be able to provide that platform to be able to do so. And so with that, this grant opportunity, it's a one-year grant period. We did request an expedited review because the grant cycle requires a 30-day turnaround. And so there was a sort of urgency to try to get this grant approved. Really, we are dealing with capacity support and capacity efforts to be able to respond to this pandemic. We were very fortunate that we had different external partners that really provided support to the health department. We want to be able to continue to lead those efforts, especially that our public health nurses will be going back into the schools. And so we will be losing some of our workforce to refocus back into meeting the needs of children and screening on that end. So the overall budget of $100,000 is really to support salaries, some trainings, and general office supplies for this initiative. And that concludes my summary of this COVID-19 effort.
Any questions from members of the committee? Alder Cupo.
Thank you, Mr. Chair. Director Bond, what is the time period that this grant covers?
And so we will find out July 21st if this is funded. We need a 30-day turnaround time for the grant to be executed and begin to start meeting the deliverables that we set out on this grant.
Okay, thank you, Mr. Chair.
Question, when was the grant applied for?
It was applied in the end of June 29th.
Okay, so this is where I'll just highlight the technicality, just honestly for the sake of the members of the public. Normally, this committee and the board are notified of grants in anticipation of applying, and that is the technicality that is being addressed for tonight. Moving forward, if there are any grants that you even remotely anticipate applying for, a notice of any kind, in particular to any chair, it could be me or anyone in the future, or the committee members, we should be notified. And with that type of, I'm sorry, I'll give you a chance. It is my understanding that it possibly came up during a leadership meeting, but we did not receive confirmation of that either. So just for the sake of the future and moving forward, if we can get a heads up in anticipation of grants like these, that would be helpful. Also, it is my understanding that the 30 days, we're well within it, and any expediting could be done through any committee process. This committee is flexible. We realize that grants come in on a quick basis, and we, unlike necessarily the full board, which meets once a month in the summer, this committee will meet anytime a grant shows up. So that is not, it'll never be on the sake of this committee that a grant cannot be applied for or any deadlines being missed. So I did want to state that for the record.
And through the chair, I just want to make a noted record that we did submit the proper paperwork and requested an expedited approval.
You did.
So if in the future you would like to be copied when we submit to the leadership, we can certainly do that. So I did I did submit before we actually applied, requesting an expedited review. And so if in the future, if you prefer to also be copied in that request, I can certainly do that.
Yep, duly noted and acknowledged. Thank you for mentioning that. Again, I don't think this will ever happen again. So just wanted to clarify that. Alder Winter.
Thank you, Mr. Chair. Can you just describe a little bit more which facilities the nurses would be working with? I know the packet mentioned nursing homes, but are there other potential vectors or places like that where we're also would deploy the nurses?
So correct. Am I unmuted? Yes. So yeah, so we'll be working with specialized populations and also contact tracing with congregate settings. If we need to support the dialysis centers, for example, to support homeless shelters dealing with any efforts, or reentry providers, those type of facilities. So those specialized populations that may have congregate exposure, we will be certainly working with those different entities. We were able to get 5 support letters from examples of different entities. For example, the Towers provided a letter of support. Advanced Rehab is another nursing home. Sorry. I've been in meetings all day. So those are the different entities that we'll be working with.
I know at the major housing authority, or former housing authority facility, Prescott Bush in my ward, there's concern about the virus coming through there, and a few folks have been infected. Is that also something where you've got a large elderly population?
Exactly. That's an exact example of an entity that we will work with. So we've worked with a lot of different partners, such as that one, to develop guidance and protocols and assist them in the event that there's any potential exposure. We've also done pop-up testing sites in certain groups where you have individuals that are not as mobile, and we've partnered to do that as well. So for example, there was one entity that had some mobility concerns, although they live in independent living, and we partnered with the Cornell Hill Health Center to organize a pop-up testing there. So those are the type of efforts that we would do. And then if there's any potential exposures, the nurses will work with these different specialized groups, and we will be convening. Some other concerns that came up were not really having a good handle on their burn rate with personal protective equipment and trying to get ahead of that. So just doing some pre-planning, because we were hit really hard, and a lot of different groups were just not prepared. And we want to try to have this COVID-19 task force as a proactive approach and have these 2 part-time nurses with the expertise to be able to provide clinical guidance.
Thanks, Director Bond. Thank you, Mr. Chair.
Any other questions from members of the board? Okay, seeing none. You, CSA and Health Department, you are off the hook. We're now going to take public testimony for all 3 grants at this time from members of the public.
Thank you.
Are there any other members of the public wishing to testify on these 3 items? Are there any other members of the public wishing to testify on these 3 items? Are there any other members of the public wishing to testify on these items? Seeing none, we will now move on with our agenda for tonight.
Mr. Chair.
Oh, yes.
May I move to close the public portion of the meeting?
No, not at this time.
Not yet? Okay,
no.
Thanks.
Thank you. You're on it. That's great. Where are we? Okay. Yes, from Alders Roth and Sabin, submitting an order calling for a workshop on local colleges and universities returning, there's a grammatical error there, to school via COVID-19 related planning and protocols. So we are welcoming in all individuals. Wonderful. I believe Mike Piscatella. Have we let in? I see Becky's here. Is Michael? Where's Michael? Oh, he's here. Okay. All right. So we will begin testimony on these items. We will welcome Michael Piscatelli and Rebecca Bombero.
Well, good evening, Alders, Alder Brackeen, members of the committee. My name is Michael Piscatelli. I'm the Economic Development Administrator for the city, and I reside at 353 Summit Street in New Haven. In a minute, you'll hear from Becky Bombero, our Director of Health, Maritza Bond. You've heard from her earlier today. And we're really grateful for members of our higher education academic community to join you tonight in a very important workshop. Just to give you a little context on it, and then city staff will step aside and listen and partner with our academic partners here today. On behalf of the entire, the Mayor Eliker's entire administration, the Alders, everyone has been working on COVID direct response and on reopen. I think you've picked up on all of the different areas of partnership with our colleges and universities. Sometimes that's a specific department. Sometimes it's mission driven by the university or the college itself. Sometimes it's just people, maybe a faculty member or a student that's been volunteering or stepping up to really assist the city in a time of great need. Of those many partnerships and efforts that have been made, a couple that were very, very important for the city over time. Albertus and UNH helping out with areas to domicile people that were either COVID positive or folks that, are first responders to help decompress maybe a firehouse or something. Yale University's partnerships on economic development and reopen. You've probably seen Elena Bell on more webinars that you've seen us at some point, and that's to really help and support so many small businesses to figure out the myriad of new rules and protocols related to COVID. So many other things that the university has done. And then Gateway Community College, for those of you who didn't pick up on, just that cadence of trying to figure out the community colleges, it was very important to get the workforce development programs early, get an early start on some of those. So many people unemployed in the state of Connecticut. In midstream for the Step Up program, which is a manufacturing-based program, Gateway Community College was able to get that class back into gear. And that was really, really important given the significance of manufacturing, a sector that was deemed essential and that's been working right on through. You're going to hear a lot, not only on what we've been doing locally in terms of reopen. Becky will give you a lens into some of the support we can offer to colleges and universities. But you'll also hear a lot about the guidance and the protocols established by Governor Lamont in the state of Connecticut. And that's informed all of the work related to welcoming a population back to Connecticut. Goes without saying, this is a very important population and a sector for our economy. It generates over $2 billion in economic impact. These are jobs held by our neighbors, our friends, people in our community. Many of the students are our neighbors, right? So a responsive and welcoming environment to bring them back to campus. There are over 22 states now listed right now on that quarantine ban. We have come back from 22 states, 14 days. Many of the students are coming back from those states, right? And you may be welcoming students and families that aren't familiar with the very specific protocols that have given Connecticut some success in the last month or so related to controlling the virus, masking up, washing your hands, maintaining physical distance. So I think one of my early observations, particularly coming out of Summer Saturdays this weekend, was does have to be punitive right out the gate for people that are unfamiliar, but to help warm, welcome, coach, explain, figure out that partnership as we bring people back to New Haven, but welcome back to a different set of protocols and rules, right? So each of the colleges that are here at the request of Alder Roth and the committee members are going to walk through what reopen looks like and what the protocols are. Becky will talk a little bit about some of the departments we've pulled in to make sure that we do our part with some of the issues that may arise off campus or on the public health side with related to contact tracing maybe. And then just generally, I think as the conversation goes along tonight, Now, Alders, you're in the community every day, and your insights about how best that we could support and partner and make this a very successful relaunch come August and early fall is very, very important. So as I turn it over to Becky, we will take copious notes tonight and figure out a follow-up set of assignments that, that builds on this work going forward. Thank you.
I think I'm off mute now. Thank you and good evening. I'm Rebecca Bombero. I am the Deputy Chief Administrative Officer for the City of New Haven. I reside at 122 West Rock Ave in New Haven. I apologize, my coworker, the four-legged one, sometimes speaks out of turn. I apologize in advance if he does so. So as Mike said, we have established an internal working group to help support the universities in their efforts to reopen. We had a first meeting in late May just to get acquainted with some of the university staff involved in their planning activities. And then we had a follow-up meeting in early June to introduce them to the health team here at the city, who will serve as resources for them as we go through their reopen process, but also to serve as resources to them. We have some of our partners from the health department here as well who can answer questions later on if necessary. And just really listened a lot to the work that they were doing to understand how best we could help and leverage them. Some key sectors emerged where we have partnerships that we can help leverage for them in the planning process, working with LCI and our large scale housing. We'll convene a bunch of the landlords to help frame some of those relationships and expectations off campus. And then we'll call it university nightlife or whatever you'd like to call it. But we'll convene a bunch of the restaurateurs, the police department to help talk about off-campus activities and how we can best assist in those regards. And we'll be scheduling those later this month and as we move through the summer and get closer to that critical point. Obviously, the health situation changes, as does the guidance on reopen in numerous sectors. So it's important to have the best information before we so with that, I'll turn it back over to you guys.
Thank you very much. And it is actually customary as a chair that I welcome the makers of the motion for tonight. So I would like to give Alder Roth and Alder Sabin the opportunity to give remarks if I'm sure you do. So the floor is yours.
Sure. Thank you, Mr. Chair and the members of this committee, and really thank you to everyone who's come to present tonight. And I appreciated the remarks of Mike and Becky about the idea of really partnering with the city. This item really does raise an important public health issue. So I'm grateful that everyone's taking the time. So we have to make sure that we keep New Haven safe from a rising COVID-19 cases when students really are going to be returning to New Haven from all around the country. And I want to preface my remarks by saying that I love that New Haven is a city with many universities and colleges. The students are the heart of these institutions. They add energy to our city, and as Mike said, they're critical to our economy. They rent our apartments, through shopping in small businesses, through job creation. And my yard literally borders the Yale campus, and it has seemed eerily empty for the past 4 months. Moreover, I wanted to say I was an out-of-state college student in New Haven and lived off campus, and I work at Yale. And so I'm very sympathetic to schools wanting to bring their students back to campus. However, the spiking numbers of corona infections across the country, particularly among people in the age demographic of most students, makes me really concerned about how the return of thousands of students to our city from across the country will impact the health of our city. As Mike pointed out, people in Connecticut and New Haven have exercised very cautious behavior over the past 4 months, staying at home, wearing face coverings, social distancing, and that's greatly reduced our infections. I worry that if we're not really thoughtful about how we reopen, how students return to campus, it risks reversing this trend and harming the health of residents and harming the economy. I see states like California reversing the reopenings, and I don't want that to happen here. I look forward to hearing from all the schools tonight about their plans to ensure the health and safety of their students, staff, and faculty, and also the New Haven community. I do want to briefly mention a few additional thoughts about Yale students returning to New Haven, both because since I work there, I know a bit more about their plans, and also my ward, like several other wards, weaves throughout and around the Yale campus. I really appreciate that Yale, and I'm sure the other schools, have taken steps to reduce the spread of COVID-19, such as shifting the academic calendar to reduce travel, holding mostly online classes, establishing testing protocols, requiring everyone to sign a community compact, reducing the number of students who are coming back to campus. However, I am concerned about the effectiveness of some of these measures, especially if the COVID cases across the country remain high, requiring many returning students to quarantine for 14 days. As people have said, it's 22 states if that happened right now. I worry that it's going to be really hard to ensure students actually quarantine. They're going to be excited that they haven't seen each other for 5 months. And just even practically speaking, they're going to go and need food unless they get everything delivered. Last Friday afternoon, I happened to walk by the Yale School of Management building and saw who I'm guessing were the executive MBA students walking out the front door because I know their orientation had just started. They were not socially distancing and had masks around their neck. To me, this was just a small example that no matter how hard schools work to structure the curriculum in campus life to protect against the spread of COVID-19, it's very hard to control individual behavior outside of these confines. I'll be interested to know if any schools have plans to have peer ambassadors influence the behavior of their students, because that may be more effective messaging than coming from school administrators. I say that as someone who sometimes has to give messaging as a school administrator. And I do worry. I represent downtown, and I have a lot of both Yale students and other people who live in big apartment buildings like 360 State and the New Haven Towers. And just today, there was an article that actually quoted a Yale doctor talking about how enclosed elevator spaces are still to be avoided. That even if you're wearing a mask, if you've been in there, if someone without a mask was in there within the past 3 hours, that risks the spread of COVID, and that concerns me. Finally, I just want to say, I also do have some concerns about the testing protocols that Yale announced for off-campus students, and that they're only required once, unlike campus students who have to get them more often. I'm not quite clear why that's the case. And also, given the large volume of testing, will we really be able to get timely results? So it would be great to learn more about that, because for the testing to have value, results need to come back quickly. Finally, I very much hope COVID cases nationwide start falling in the next few weeks, and I'm being overly cautious in my concerns. But I do feel it's important to make sure schools have realistic plans and contingency plans to ensure that everyone returning does so safely, both for the schools and for the community. Thank you very much for all your thoughts tonight.
Thank you, Mr. Chair, and thank you, Abby, or Alder Roth, and thank you all to all the administrators and city staff who are here tonight. I echo everything that Alder Roth said. This is an incredibly important conversation, and I represent many of the students who live in Ward 1, and there are many New Haven residents, longtime residents who may be elderly, who live in buildings, or who shop at grocery stores, or go to restaurants, or who walk on the sidewalk that are shared by many of those students. And so I think it's critical that we're having this conversation to make sure that this process that's on schedule to happen in the fall happens safely. And I think I wanted to emphasize something that Alder Roth mentioned, which is I would be interested in working with the task force that has been set up to see whether it might make sense to include some more representatives from the student body or who represent the community at large, to be a part of the conversations that we're having, just so we can facilitate sharing information and make sure that the messages that we want to get out to the students are getting out and are being followed as much as possible. Thank you, Mr. Chair.
Thank you both for this vital and important item. So I have a list of universities here, and we're going to try to, I guess I'm going to draw numbers. So here we go. University of New Haven is 1. Quinnipiac University is 2. Albertus Magnus is 3. Southern Connecticut State University is 4. and Yale University, you are 5. Now, I have named those orders in order for you to introduce yourselves. So you'll state your name, your address, and your university affiliation in that order. So University of New Haven.
Point of chair, Mr. Chair,
Yes.
are we keeping time on?
No, they are all invited guests.
Okay, thank you.
Thank you for the clarification. All right, so University of New Haven, there's no representatives here. Okay. Quinnipiac University. All right. Albertus Magnus.
Good evening. Thank you for having us here. My name is Andrea Kovacs. I'm with Albertus Magnus College. My address is 356 Fairview Avenue in Bridgeport. And my colleague, Dr. Stephen Gestalder, will actually answer questions on behalf of the college.
Okay.
Thank you, Andrea. And thank you for having us here today. So my name is Stephen Gestalder. I am actually a New York resident. I live in 3 Johns Road in Valhalla, New York. And my university affiliation is, well, Albertus Magnus College.
Okay. And we will come back to you all for testimony. Southern Connecticut State University. Okay. And now, Yale University. State your names and addresses for the record.
Hi, it's Lauren Zucker. I hope you can hear me. It says my internet connection is unstable. 433 Temple Street, New Haven. I am Yale's Associate Vice President for New Haven Affairs and University Properties. I am joined by a number of colleagues here. Would you like them all to introduce themselves or kind of as? Okay.
Yes, please.
I will call upon them so we don't all speak at the same time. Stephanie, do you want to go first?
Can't hear you. Stephanie, you're muted.
Okay, it appears that she's muted, so we'll go to the next person.
Maddie, do you want to go ahead?
Hi, my name is Maddie Wilson. I am an internist and the Chief Quality Officer at Yale Health, and I am the chair of the Testing and Tracing Committee at the university. Oh, and my address, I'm sorry, 1050 State Street.
Don, do you want to go next? Don Filer?
Sure, I'm Don Filer. Address is 200 College Street. Associate Vice President Global Strategy at Yale, and oversee the logistical part of move-in processes and isolation housing.
Thanks. Melanie?
Hi, I'm Melanie Boyd. I am the Dean of Student Affairs in Yale College. So I'm working closely on how we're actually going to keep our students abiding by the compact and all of that.
John Mays?
Hi, my name is John Mays. I live at 130 Glen Ridge Road in Hamden, Connecticut. I'm the Associate Vice President for Administration, and I'm responsible for graduate student housing. We have a few of my team members here who you'll hear from in a minute. I'm also responsible for the parking and transit infrastructure for the university and a few other administrative services.
And George?
Good evening. My name is George Longier. I live at 96 Ash Drive in Hamden, Connecticut. I am the Director of Graduate and Professional Student Housing on campus.
And Stephanie, go ahead.
I think you can hear me now. Yes?
Yes.
Sorry for that audio glitch. My name is Stephanie Spangler. I reside at 66 Deepwood Drive in Guilford, Connecticut. I am Yale's Vice Provost for Health Affairs and Academic Integrity.
And then I think most of you know Karen. Karen, go ahead.
Hi, I'm Karen King. I'm at the Office of New Haven Affairs at 433 Temple here in New Haven, and I work in community affairs.
And Lauren, I've failed to give my address, I realized, which is 13 Cooper Road in North Haven.
Wow, that was a great introduction, folks. So we will now go back to the top of the list, yes, Albertus Magnus, the representatives, you may present your testimony.
Up on the top. Thank you very much. We had prepared some questions. I'll just kind of start at the top and just kind of say that Albertus Magnus College is planning to welcome back all of our students to the campus starting on August 24th. And we made some of our plans so far available on the college's reopening section of the website. We understand things are changing, and so we are adapting our plans as the situations change, but we're communicating as much as we can publicly there. So as far as what we are expecting or who we're expecting back, right now we are expecting back about 300 of our resident students and 200 commuter students. And then we also have, because we have a large adult continuing ed population and graduate students, another 1,000 students or so will be coming back to campus. Albertus is really very much a regional and local school. So most of our students come from Connecticut. We have in the past year, out of our population, a total of 1,300 were Connecticut students, residents. We've enrolled about 100 students from outside of Connecticut and 23 international students. So far going forward, we have 3 students who have lived in states that will be that are on the quarantine list: Florida, Wisconsin, and Texas. That's all. For the incoming class, we have about 16 international students. But of all the students who are coming from outside of Connecticut, they're all coming from neighboring states. As far as students living off campus, as students, we really don't make a distinction between commuting students and students who have chosen not to take our residence halls. And so we do not ask them to register with the college. So we really don't have an indication of who is our students who are not living on campus. Regarding our rules, we've noticed that, as I mentioned, we've notified our students through our website, and we also send regular messaging from both student services and from our president, Dr. Mark M. Camille. Our new undergraduate students will receive 2 weeks of online orientation before they're arriving on campus. And returning students then will also receive similar type of information. We'll be asking all of our students and members of the community to log their general health conditions through we're choosing the Campus Clear app, including those that are in quarantine. And we, being a Catholic institution, we do also rely on our code of conduct very heavily. And we'll be asking our students to adhere to the college guidelines as part of that code of conduct. Going down, our students, we are, the question about student ambassadors, we are asking a group of students working with some administrators to create some video messaging, just so that understanding that students will listen to other students. And those messaging will be short, little fun messages, but really stressing the importance of staying safe and staying in quarantine as needed. And then regarding the messaging that we are giving to students for the way that they're interacting, we will be, for instance, for those who are in quarantine living off campus, we will be providing guidance about how they can stay safe, but we will not be providing funding for them to purchase any groceries or do anything along those lines. And as far as similarly, when anyone else is coming on campus, part of our overall health and safety guidelines, both new and returning students, they'll be staggered across several days, and there'll be really guidelines about how they can continue to stay safe, both for anyone who's coming on campus with the students. We will be limiting the number of family members that will be coming on campus to bring our students on, although we also recognize, especially for many of our students, that going to college is a family event, and so we want to keep that as important as possible. Regarding student testing, we'll be asking our students to bring a proof of test, and we'll be testing those that do not have a proof of that test. And that test that we're asking will be of 7 days before arrival, a little bit more conservative than the guidelines. We're still working out the details of our identified provider, but most likely the results will be back within 24 hours. We'll be isolating all students and be asking them to notify, and we'll be notifying all students regardless of whether they're living on campus or off campus. We also are treating both our commuting students, whether they are living off campus or just local commuters, as well as our residents in the same way. So we'll be testing them all to the same degree. We will be doing a randomized testing of a percentage of our population, over 10% of both residents and commuting students. And then as far as quarantining, any roommates will be treated as family units, and they'll be asked to quarantine and stay safe in the same way. And similarly with the question about who we'll be notifying, because as I said, we do not ask our non-resident students to register. We don't really distinguish, but we will be asking as part of our standard COVID information protocol. We'll be advising all students to contact anybody who they've been in contact with, including neighbors and landlords and really anyone that they have had come in contact with. Regarding as far as trips to downtown, we do have a shuttle, a small shuttle, but we will not be using that to bring students downtown. So as I said, similarly, the students will be sampling students both on and off campus in the same frequency and testing the same way. And as students are living off campus, whether they're on or off campus, we'll be asking them to quarantine. If they are local, we may ask them if they can safely do so to return home, especially even our resident students. But if they cannot, we do have some areas on campus that we are setting aside for isolating. As far as enforcing the guidelines, the college is, again, we've expanded our code of conduct to handle any of the infractions against the rules of quarantine and staying safe. And we'll use the current adjudication system to enforce any of these rules. And again, that really, any of the consequences will be part of the current adjudication system. So I think that's the general testimony.
Thank you very much.
Thank you.
I think we'll reserve questions for after the presentations. Okay. Was there a representative from Southern? And it looks as if Alder Clyburn has joined us by phone.
Yes.
Okay. So we will move on to Yale.
Thank you. Good evening. It is nice to see everyone. And thank you for inviting us to this workshop tonight. As you can see, I am joined by many of my colleagues this evening, and we really wanted to share Yale's plans regarding our reopening. Ever since the pandemic first hit, Yale has been engaged in discussions with the city and the state, focusing first and foremost on the health and safety of our community, including students, faculty, staff, and our neighbors. Our recent reopening plans were based on months of consulting with public health experts and constituents from both within and from outside the university. And, we've had to make some difficult decisions about how best to reopen campus in a safe and thoughtful manner. And as such, I'm going to turn it over in a minute to Stephanie Spangler, who, in addition to her regular introduction, has also been chairing Yale's Public Health Committee and has been appointed Yale's COVID-19 coordinator. And Stephanie's going to really walk you through our plans, which will continue to evolve, as unfortunately so too does the pandemic. And we want to assure the board and the New Haven community that we are truly partners in this effort. As many of you know, since the pandemic hit, Yale has been responding on a number of fronts, through the clinical work of our doctors and nurses, housing first responders in our dormitories, the research and public service of our laboratory scientists, epidemiologists, and other public health experts. And Stephanie may touch on these areas a bit more. Additionally, One of our very first actions when the pandemic hit was our establishment of the Yale Community for New Haven Fund. And to date, we've funded about 70 local organizations focusing on supporting the delivery of healthcare, community educational needs, and supporting local nonprofits who are focused on pressing issues such as the well-being of children and family, homelessness, and food insecurity. And the fund has been and continues to support organizations and individuals most impacted by this pandemic throughout the city. I want to offer up some useful websites. We're going to go through a lot of information, but to the extent you have additional questions, we have a ton of information on our covid19.yale.edu website or on onha.yale.edu, where you can find more information about our reopening plans, as well as our support for New Haven during this pandemic. And with that, let me turn it over to Stephanie.
Thank you, Lauren, and thank you again for having us, and thank you, Alder Roth and Alder Sabin, for your comments, and we'll try to address them among us. I'm going to give an overview of our planning and in the context of which we're doing it, so you get a sense of our thinking. This has certainly been a unique and very challenging time that we've shared to date, and we've really appreciated the partnership of the city. Director Bond served on our Public Health Advisory Committee during the period of shutdown and was a very, very good partner in sharing both information and ideas. As Lauren indicated, I chair a Public Health Advisory Committee, which is one of a number of committees that was convened in the spring to address both how we keep our communities safe and healthy during the shutdown and also how we might think about reopening. And our committee's role was to provide public health expertise and to really conduct continual surveillance, not just on the local situation, the state situation, but also on developments nationally and progress being made in treatments and prevention for COVID-19. It is a very challenging, and I'm sure you know, very fluid field to keep up to date on all the information. And so we have plans today, but we realize based on public health information, our plans may change tomorrow. We also realize in our planning, so it was our committee that was asked to think about what conditions would have to be prevalent to even consider bringing students back to campus. And I will emphasize that we recognize, as all of you do, that the virus knows no boundaries, no state boundaries, no national boundaries, no municipal boundaries, and certainly no institutional boundaries. And a key feature of our thinking was to think about our neighbors, to think about the New Haven community, realizing that we are bringing, when we reactivate our campus functions, we're bringing students, faculty, and others from many parts of the country, and also that we sit proudly and happily in the middle of New Haven, and our students call it their home and enjoy being in New Haven, but that puts them in close proximity to many of our New Haven neighbors and our New Haven citizens, and that was top of mind in our planning. So we have reactivated on-campus activities more slowly than the state would have permitted, so that we could really observe how effective our safety measures were and how compliant our faculty and staff were with adhering to those safety measures. So in the beginning of June, during the period of shutdown, we did allow some research to continue, but only research that was addressing COVID, ways that it might be detected, treated, and prevented, and essential functions on campus. We allowed some research labs to come back on campus in the beginning of June, but only those labs whose work could be done only on campus, and only if those labs completed a safety plan where they would commit to all the social distancing, disinfection, de-densification, and other guidelines, face covering and other guidelines that we had in place. We did this intentionally to repopulate gradually and to see how that repopulation would progress. During that time, we ran a pilot program of asymptomatic testing. It was voluntary, but we tested over 1,500 of our returning faculty and staff. And we're pleased that a very, very low 0.2 to 0.3% positivity for asymptomatic individuals. Now, these were individuals coming out of a stay-at-home situation, so we're not resting on any one number or becoming complacent with it. We are going to expand opportunities for faculty to come back on campus to do research in additional labs with the same conditions, that they adhere to all the health and safety guidance. We do plan, and our plans are on the covid19.yale.edu site. I think transparency is really important. We want people to know what we're doing. We want people to ask questions. And so much of the information about our plans is on that site. We plan to put as much as we can on that site. At the beginning of this month, our president and provost announced, after much deliberation, that we intend to allow some students to repopulate our residential colleges. We felt it was very important that we not repopulate the residential colleges with all of our students. COVID, the risk of transmission is greater with the greater density of individuals interacting with each other, and particularly over long periods of time. So at this time, the plan, which contemplates allowing first years, juniors and seniors to come back to campus during the fall, with sophomores remaining remote and learning remotely during the fall, could result in up to 60% of our students returning to campus. We don't think it will be a number that is that high. All of our undergraduates and all of our graduate and professional students are also coming back to campus. Each, as was the case for research labs, each professional school is creating a plan demonstrating how they will adhere to density, social distancing guidelines, and other health and safety measures. And all students coming back to campus, whether they're graduate and professional or undergraduate students, regardless of where they live, will be required to sign a compact where they agree to abide by all of our health and safety measures, agree to be tested, agree to isolate if they test positive, agree to quarantine if they're told to quarantine. And there will be a special mechanism in place to review incidences of noncompliance. After I give the overview, I'll turn it over to one of my colleagues, Melanie Boyd, who's the Associate Dean in Yale College, who can speak to the, I think, Alder Roth's suggestions about ambassadors and peer educators and peer influencers is really, really important. We think that's important, particularly for undergraduates. So we have reconfigured our buildings, reconfigured our dining services to allow for grab and go, to make sure there's social distancing. Plexiglass is in abundance in terms of barriers, as well to supplement face coverings. We've thought about use of elevators, entryways, exits, in terms of promoting safety. I will never say anything in this environment is absolutely safe. I think none of us can. The virus is still out there, and we're very cognizant of that. And nor do we want to convey to our students or to our community that everything is completely safe. We need to be on guard continually and continually take care not only of ourselves but each other, because each of us is going to be well only if all of us is well in this environment, and that's very important. And that's the spirit of the compact, that's the spirit of the signage we have. I do weekly reminders to the community, bringing up one safety measure or other each week, and I can certainly go into detail if you wish. So a number of our health and safety measures are there because they are evidence-based, based on public health guidance, state rules, CDC guidance, and again, we continually refresh that guidance, and they're there in the hopes of preventing transmission. Those are the face masks, the 6-foot distancing, the reduced density of spaces, the disinfection. We also, realizing that the virus is not gone, need to take measures to quickly identify and control any viral transmission. And that's what our testing program is geared to do. And I think Alder Roth asked, why are we focusing on undergraduates and in residential settings? And the risk of transmission of this virus, as I said, is a function of both time and space. And our feeling is that the highest risk for transmission is in those areas of congregate living where people are together over long periods of time. Additionally, we know that younger individuals are more likely to be asymptomatic, and our own researchers in public health have just come out with publications reinforcing the fact that asymptomatic transmission is a real risk. And so we really feel the need to do testing that will find not only symptomatic cases of COVID, but asymptomatic cases of COVID. And so our current plan is we are going to go for pre-arrival testing for our undergraduates. We are going to follow state guidelines in terms of those undergraduates and graduate and professionals and faculty and staff who travel from the 22 states of concern. We're nonetheless going to test all arriving undergraduate students and then test students at least weekly throughout the semester. And when I say semester, we have intentionally, as I think many of our colleagues have done, peer schools have done, limited the semester to the time period between August and Thanksgiving so that students are not traveling back and forth to campus, and they will complete their fall term studies remotely. They will finish up the fall term remotely in December. But once they travel for Thanksgiving, they're not coming back. We will reassess what spring semester looks like and invite students back as indicated. We have reserved space on our campus for isolation. I should mention with part of one of the intentions in reducing our density is to make sure that we could have only one student per bedroom, which is not the usual situation at Yale. But we also had additional capacity by reducing our density that we are going to use as an isolation unit. So we have reserved isolation beds. We actually made those beds available this summer to first responders in the city and to healthcare workers, and actually not only got to take care of those individuals, but also got to test our capacity to provide isolation services such as food services, monitoring, and other services. So we do have isolation space. We intend to quarantine. We have contact tracing. We are coordinating with the city. We have a team of contact tracers to do the contact tracing for the Yale contacts and are coordinating with the city Department of Public Health about how to make sure all contacts, both Yale and non-Yale, are appropriately approached and instructed. We will have teams of healthcare providers monitoring students in quarantine to monitor for symptoms, to monitor for any deterioration in their symptoms. Students will not leave quarantine or isolation until they're directed by a healthcare provider. And that is our current plan. We reevaluate it at least daily in terms of what the prevailing public health conditions are and what the emerging guidance is. We are likely to use an outside vendor for our testing, our weekly testing. We're happy to tell you more about that. The reason I have so many colleagues here is because for us it takes a lot of people to do this planning, and I'm very, very grateful to have lots of people working with me and others to implement these plans. We are discouraging travel. I think that was one of your other questions. Once students get to campus, we want them to stay on campus. We also expect them in the compact to observe all of our health and safety measures both on and off our campus, and that is part of the compact that they're signing. I'm going to maybe stop here with my overview, with the one sort of less positive ending is that we also are planning for what will trigger us to close a dorm, to close down completely, certainly we would follow state rules or city rules guidance in that regard. But we are also monitoring our own testing results and the prevailing public health guidance. So I would like to either turn it over to the committee for questions. I can also turn it over to Dean Boyd if you want to hear more about the peer ambassador program and how we're going to address compliance among our students.
Great, thank you. Actually, I will take this point to ask members of the committee if you have any questions for Albertus and the first overview portion for Yale. Are there any questions so far? Alder Cupo.
Thank you, Mr. Chair. So these questions are specific for Albertus. First, is logging into this app that you described to log your health a requirement for being on campus?
Yes, it is.
Excellent.
We'll make that a requirement for all students, all faculty, all staff, and any visitors to campus, including vendors that might be coming on to do some work.
Excellent. And currently or presently, is there a set of consequences if students do not log daily or choose not to do so?
Yes, we'll be following up with them through our student affairs and again, using the adjudication process. So it'll be a warning, and then we will take it further from there if they do not continue to comply.
Mm-hmm. And you mentioned that there would be a limit that in terms of move-in day, or you mentioned there may be other events taking place on campus. What is the limit or the number of visitors per student, if applicable, for move-in day and any on-campus events that are happening during the fall?
We're going to continue to adhere to the guidelines from the state as far as limiting the number of anybody who's coming in for group gatherings. And so family units will ask to adhere to that. We will, for the most part, really advise students to really bring 1 or 2 members of their family. But if they have requested to bring siblings or grandparents, we'll advise as far as safety and the concerns of doing so. But again, this is oftentimes a family decision, and many families are supporting the students who are coming to campus. They're often first-generation students, and so it's really meaningful. And so we don't want to disrupt that. That's often their support system, and we'd like the students to continue to have that to rely on.
Mm-hmm. And lastly, I'm a bit concerned, right? So we're talking about a global pandemic that could potentially spike again in the fall in a very serious way. We're talking about a population of young people that are coming to New Haven, where New Haven already has challenges or is anticipated to have challenges with this. My only concern is I've heard you use the words ask and advise that seem just a little bit, they don't really have teeth. I understand there's a different, you have I'm not familiar with the policy or the number of steps that you have for discipline around any, like if these were to be violated, but I just want to stress like having a mechanism in place that students either have to, like I don't believe that there is room or space or frankly, we're talking about people's lives. Like there needs to be some kind of hard, concrete consequence or something with teeth, so that like we are all taking our own personal responsibility in this incredibly seriously. And that's all I had, Mr. Chair.
I appreciate that, Alder Cupo, and it is something that we take very seriously. All of our students will be asked, really, and faculty and staff as well, but will be asked to sign a pledge that will adhere to the guidelines of not just the college, but of the state and local authorities. It's really my colleague Andrew Foster that who's our Vice President of Student Affairs, who really handles the discipline. But it is something that we have a very strict discipline process in place, and it's something that we do apply to other infractions on campus, and it's not not something that we take lightly. This is something that we are taking very seriously, and will continue to do so. So there, we will be obviously looking to have peer guidance for enforcement. Something that Dr. Camille is very concerned about is making sure that our students are, being informed and that they are not just from the administration, but also from their peers, that they are following the guidelines. And so we'll be relying on some of that, but then also, yes, we will be using our adjudication process to ensure that adherence to the guidelines.
Okay, we have a question from Alder Clyburn.
Thank you, Chair, very much. Please forgive me. I just couldn't get in the other way, but I really had questions way back. But this is for Albertus Magnus. Now, all the colleges are following the safety measures and guidelines of the state, correct?
Yes, we are.
Okay. So, I heard, so, okay. Now I have a question. I haven't heard about how many students will we have in a classroom?
That's a good question. And we have, there's the report that we submitted to the state that really does indicate the adherence that we are, our plan is taking to all the guidelines that are in place, and we'll continue to adjust to that. Our students, we typically have small classes. We are not as a liberal arts institution, I think typically our largest classes are no more than 25 or 30. And what we've been doing is taking an approach of splitting any of the classes into two subsections, and then giving the instructors the option of how they would like to instruct those students. We've taken a look at all of the capacity of the classrooms and limited it so that we're reducing to allow only students that would fit, allowing the 6-foot distancing. We are also requiring all students to wear masks when they are on campus and in the classroom. And we are, so the professors then will have half of the class in the classroom and half the class either joining remotely or doing asynchronous coursework to complete that seat time. And then on another class meeting, they might switch that. But we're through a combination of splitting the class sizes into sections and using technology to bring some students in remotely is the way that we're ensuring that the distancing within the classrooms.
Okay. So if there's 25 students, that would be half, and if it's 30, that's half.
That's right. Yeah, we typically don't have that size, and then we would find the classrooms that would fit the 8 to 10 students or so. Sorry, didn't mean to interrupt.
Okay, and you answered my other question. You said everyone is wearing masks in the classrooms around the campus. And also, how many students to the bedrooms there?
We really typically have very few triples. We are keeping those now down to doubles, and we are treating all roommates as family units.
Mm-hmm. And how? Okay. So how often would you test them?
Weekly, we'll be testing a subset of our population, a percentage of our population. Yes, not our entire population, but we do randomized tests of our students.
Mm-hmm. Your students that don't live on campus that come, they're day students, they will be tested as well, correct?
That's correct, yes. Yes, we will, exactly. We will be treating the resident and the commuter population the same. So they will all be expected to come to campus with either a proof of a test, or we'll be providing tests as they arrive. And then we'll be testing the sample testing, both the resident and the commuter population to the same degree.
Okay.
Yeah, many of our commuter students work and integrate with our resident students in clubs and in activities. And so we want to make sure that all are safe and tested.
Okay. And the way they would eat, the ones who live there, would be, how would they do there? I heard what Yale said about the way
Sure.
the students would eat there?
We work with Chartwell's, our dining service vendor, and they're developing a plan. That the draft plan has 3 or different options of food delivery, and there are 2 that we will be choosing from that, and we'll be adjusting that accordingly. But the 2 plans will be either in dining room dining with distance between. We're removing seats in the dining hall so that ensuring 6-foot distance between. But most likely it'll be grab and go like lunches or and dinners that will be provided, so students can take them back and eat them outside of the dining hall.
Okay. All right. Thank you, Chair. Thank you so much. Thank you, sir, for answering my questions. And then I thank you, Chair, for giving me this chance to ask questions. And I may have more, later.
Absolutely. We'll do a round robin for the second half.
Thank you.
Okay.
All right. Alder Winter.
Thank you, Mr. Chair. Can you explain for the gentleman from Albertus Magnus? Can you explain more about the adjudication process and the disciplinary consequences for students who are not following the protocols?
No. Okay. Again, the adjudication process is we typically run, it's through student conduct. There's a board of administrators and some students that students are brought in front of when there are infractions, and they go through that judicial process of hearing what the issues and the conduct has been. As we go forward into this next semester, that same process will be used for any students that are not adhering to our guidelines, and they'll be brought up in the same manner. And typically, the adjudication that will be fines and up to the point. We focus on student success, and we really are strict. Many of our students, again, are first generation. We really focus on giving them the resources, and so this could involve up to expulsion, but I think that would be a very drastic measure. I don't expect that our students would continue to cause infractions up to that point.
Could you give us some more details on what information the app will track?
Sure. It's a self-reporting app. It's a questionnaire. Everyone will just log in. There's some general health questions about how they're feeling, just symptoms that they check off, and then we will load into the app our student schedule. And so students will be both the residence halls and their student schedule. So anybody who then does indicate self-reporting that they are not feeling well, then the app will then give us a report. It won't notify other students, but will give us a report, which we can then use to proactively trace those students that are in that residence hall or who had attended class with that student.
Will the app track students' locations?
It will not.
Okay. Thanks. Mr. Chair, is it appropriate to ask some questions of Yale at this point, or would it be better to save those for later in the...
Well, they have a second half, so let's save them for later.
Okay.
Thank you.
Thank you. Thank you, Mr. Chair.
Alder Sabin.
Thank you, Mr. Chair. I was wondering if you could talk a little bit more about your plan to test a certain subsection. You mentioned 10% as a number earlier, and I was wondering how regularly you're planning to do that and what sort of the purpose of that is, whether it's sort of to monitor the spread of COVID within the population, and with that, does that mean that there's a certain threshold of positive rates that would lead you to shut down campus or make other changes in how campus is operating? More details on that. Thank you.
Sure, Alder Sabin. You were going in and out a little bit, so I wasn't sure I caught all of the questions, but it was regarding testing and our frequency of testing our students. As I said, we will be testing all or asking for students to bring proof of test before they arrive to campus or testing them. And then we'll be testing 10% of our resident and commuter population on a weekly basis as we go through, capture all the entire population in that way. The threshold, as far as taking a look at the percentages, I think we'll be looking for guidance from the city and state authorities, as well as our health services, as far as what that threshold would be. But we've not come to a determination of what that trigger would be for us to then take that next action.
Okay, thank you. Thank you. Sure.
Alder Roth, you didn't have any?
I had one follow-up question to Yale, but I'll wait till after the full presentation. Thank you.
Alder Cupo.
Thank you, Mr. Chair. My questions are directed at Yale. Should I wait until they're finished with the presentation?
Yes, please. Thank you.
Sure.
Okay. Are there any other questions for Albertus? All right. Seeing none, I'm actually going to let you off the hook here. And I appreciate you so much for your transparency and even coming to the table. It is a great, you all have been a great partner to the city for so many years. And we appreciate, and we'll be in contact, I'm sure, as in the days ahead concerning the onboarding of students. So have a good night.
Great. Thank you. And thank you for the opportunity. Thank you for the opportunity for talking.
Good night.
Bye-bye. Good night.
Okay, we will continue. Yale University.
Hi, so I think I'm up next. So again, I'm Melanie Boyd. I'm the Dean of Student Affairs for the undergraduate community, although I have some connections into things that are going on for the graduate and professional school students as well. There are so many different plans that are underway. I am going to focus right now, I'm sure you have questions about all kinds of things, but just since it seems to be the main area of interest, I'm going to focus a little bit on our educational plans and the strategies that we're developing to hold students accountable to the compact that they're promising to abide by it as they come back to campus. So one thing is just sort of recognizing that for any public health endeavor, yes, you can set expectations, you can put disciplinary structures in place. You really also need to be able to be teaching both working on attitude shifts and teaching active skills. So giving students strategies for managing the things that we're asking of them. So that's where we've been putting a lot of our focus. We've worked on building out a community compact that's partially really making sure that we've detailed very closely before they arrive what our expectations are of them. That includes being aware and keeping themselves up to date on local and state ordinances and guidance so that they have to abide by our rules, but also New Haven's and Connecticut's. We also have asked of them, within that, there's a whole set of particular practices that we're asking them to do. And some of those, because the public health guidance is evolving so quickly, aren't yet as fully detailed as they will be, but we're anticipating being able to link from that document out to other more detailed guidance as we pin that down. We are, for all of our students, they're not just signing that compact, but they're going to do an online training that will be structured around the compact and building out a number of different safety skills that they need to learn. So, we're asking them to disinfect bathrooms before and after use. What do we actually mean by that? So we're still working out a lot of those pieces, but students will have to be able to complete all of that before they're allowed to register for classes. So long before they get here, because they pre-register before they come. For the undergraduates, at least, that will be the timeline. I think the graduate and professional school students are on a similar timeline, but I'm less in the weeds of that. Once they get here, though, so we're doing that, we're doing orientation online. We've moved all of the things that we normally do in person to welcome the new class online. So we are, of course, we can't move their move-in online. So that's one of the pieces we're paying a lot of attention to. At this point, we could change based on conditions, but at this point we think they are going to be allowed to bring family members with them, but we're working very closely to set up windows of time so that there will only be one family going through any given. Our dormitories are mostly entryways rather than corridors, so they kind of go up. We'll only have one family moving in and out, moving into an entryway at a time. So we're doing a lot of complicated staggering in that way. We have set up, as Stephanie said earlier, we're setting up a new system for how we're enforcing the community compact. Things could eventually end up at the undergraduate level, at least hitting our disciplinary system. But we think the most powerful motivation, and some of this comes out of research on adolescent psychology and public health, tapping it into the public health mode, right? So that we are constantly reminding them that these are things we are asking them to do, not just because we've made up some rules, for the sake of it, but because the health and safety of the community depends upon it. And I think being able to have a separate structure helps underscore that. So we're setting up those kinds of mechanisms. We're building in. There will be automated triggers that happen if they're not doing their daily check-ins, if they're not being at their tests on time. All of those sorts of things we're trying to build into the workflow of their day-to-day lives, so that there will be sort of low-level penalties that kick in. But more importantly, at any moment that they're not meeting those expectations, we're also wrapping that around not just with penalties, but with support and sort of guidance counseling services. So we've been building at the undergraduate level. I'm in the process of building out a team of 17 graduate and professional school students and 25 undergraduates, plus a professional clinician to supervise them, who will be responsible for doing both kind of peer, near peer, and responsive interventions. So rolling out both education, skill building, trying to do some creative stuff, because we know that our students are not just going to sit quietly in their rooms. So figuring out, this is a lot of what I think the undergraduates will be doing, is figuring out what are the activities that they can safely engage in, and building, we talk about this sometimes as building new paths, right? You can't just tell them not to do something, you have to give them other alternatives. So we're going to be doing a lot of that work. Those same people will be working in a more one-on-one way with students who are having a hard time meeting their compliance expectations. Ultimately, we would be asking a student who can't stay in compliance with the compact to leave campus. We'll be sending them home. They need to be able to do this. If they can't do this, they can't be here with us. This is going to apply to all of our students who are in residence. So that includes, for the undergraduates, it includes undergraduates who live off campus, as well as undergraduates living on campus. And at this point, we're expecting about a quarter of them to live off campus. Those, I think, are the main pieces that I wanted to make sure that I addressed in describing the plan. Obviously, there are many more details, but maybe I'll pause here and let you all ask questions of any of our group.
Okay, we'll take questions from members of the committee. Alder Clyburn, I believe you have a question.
Yes, I have a question. Thank you, Mr. Chair. My question was for Albertus Magnus, but I would ask it here as well. How often will the staff be tested? The teachers.
I can respond to that. Again, my name is Maddie Wilson, and I'm leading the Testing and Tracing Committee. At this point, our plan is to focus our intensive testing efforts on our undergraduates and the small number of graduate students who live in congregate housing, for all the reasons that Stephanie outlined, because we feel that that's where the level of risk is most substantial, and the best way that we can protect actually the faculty and the staff and the community is who are often more vulnerable in some ways than the students are, because they're older and they may have more underlying conditions. The best way that we can protect them is by testing our students and making sure that our students don't become the nidus or the start of an outbreak that could spread beyond the residential college. So at this point, our plans are to offer an arrival test to our faculty and staff who will be returning to campus. Many have already had testing as part of that return process, but we're not, for most faculty and staff, we will not be doing recurrent testing. Anybody has access to testing in the setting of symptoms, or if they're concerned about a particular exposure. We'll also be offering testing to anybody who's been a contact of a case. There will be a small group of staff who and faculty who are working very closely with our undergraduate population. Mainly they're the staff who work at the residential colleges, like the dining staff, the custodians, some of the other administrative staff and faculty. And those individuals will be part of our weekly testing program, given their proximity, both to prevent an outbreak on campus and also to prevent spread from campus to the community. Did that answer your question?
Your teachers, your faculty that teach your students, they will be weekly?
No, most of them will not actually be weekly. And part of the reason that we're not recommending repeated testing of that group is because they live off campus. So if 99% of them, and they're adults, and we expect their capacity to follow the guidelines that we have set out across the campus is much greater than that for undergrads. Not to diss the undergraduates, but 18-year-olds are 18-year-olds. So we won't be recommending regular testing to our faculty in the absence of some other indication.
Okay. Because, sometimes that's how things get into, sometimes not always through your students, but, the teachers who teach them, that they come in contact with their professors, as well. Now, my other question was, now this is talking with the staff from Yale, correct?
Yes.
Hello? Okay. So are we going to have students and professors coming from other countries, or no?
It's certainly possible. It depends upon the travel restrictions, which are many right now. So, and those people traveling into the state from another country or from one of the states of concern in the United States will have additional testing and likely quarantine requirements.
And just I can add to that, many of our graduate students, our international graduate students, many of them consider New Haven their home now. And so many of them have been here since March and continue to live in and reside in New Haven. So there will be international students enrolled at Yale, but a lot of them are also New Haven residents or have stayed since the pandemic broke out.
Okay, yes, but I'm just saying any new students and professors coming from another country, or that's what my question is. We're saying no or yes?
It's likely we will have some if they are allowed to travel, but the allowance for travel depends on the public health conditions. We are not currently allowing our faculty to travel internationally. We're advising against it, so we don't have too many faculty who are coming back. So I don't have numbers for you, but we may very likely have some international students who can travel back.
And those students would all be subject to the gateway testing upon arrival.
And likely even more testing because of depending on where they come from.
And testing and the quarantines that go with the testing.
Correct.
All right, and this also applies to the professors as well that may come.
Yes. Yes.
Okay. I think you answered my, you already answered about your students, how many students in a bedroom and how many in your class size.
We are expecting most of our classes to be taking place online. So there may be some limited in-person classes for classes where it's really necessary, but the bulk of our teaching should be happening online or in possibly very small sections, similar to Albertus Magnus, where we have a very small group of students strategically placed in a larger classroom where they can be 6 feet apart and with masks and following all of the other public health guidance.
Okay. All right, that's it for now. Thank
Okay, Alder Cupo.
Thank you, Mr. Chair. I just wanted to clarify a statement made earlier about the percentage of students who will be coming back to New Haven but living off of campus. So is that a quarter of the roughly 60% of students will be coming back?
That was from me, and I was speaking of undergraduates. So about 80% of our graduate and professional school students live off campus. I sometimes forget about them because I'm very undergraduate focused, so apologies there. Of the undergraduates who are coming back, they are still in the process of declaring their intentions to us, so we don't have our complete data set. But of the early responders in the survey, it looks like about a quarter of them would be living off campus.
Okay. And what plan is in place to track that population?
They will be in our testing and the community compact and all of those other pieces. For the undergraduates, they're all assigned to residential colleges, and which are more than just dorms. They still have the college leadership is connected to them even when they move off campus. So they're each within Yale, there are 14 sort of sub-communities, and each sub-community has a set of staff who are responsible for overseeing it. So it's not the entirety. My office is central, so we also will be doing some overseeing, but there are people whose names they know and faces they know who will be paying attention and tracking. If they're not cooperating with the testing, with any of those other pieces, we have people in place to help pull them into line.
Okay. And so just to re-clarify, so that means that, let's say a student who is aware of maybe the restrictions in place in the residential colleges is like, I want to come back to New Haven. I don't really want to be under that like very fine lens, so to speak. And they decide on their own accord to, find an apartment in the city, be it in the Dwight neighborhood, close to campus, or in Worcester Square, or in Edgewood. So just to clarify, so you've said that despite them not living like in the footprint of Yale, there will still be an administrator or someone from residential colleges who will be responsible for them completing these things that they need to in order to stay in compliance.
It's complicated in that we're going to have two categories of students. So the students who are enrolled in residence, yes, they are going to be part of, and we're calling this in residence. We haven't needed this terminology before, but who have access to our campus, who might use the library or come into the residential colleges, be part of an extracurricular group in person with a mask and distancing, those sorts of things. Those people are going to be in the compact. We asked our sophomores not to come back precisely so that we would de-densify and have a lower community. So we are in every piece of our messaging saying to them, do not come to New Haven. You are supposed to be studying from home. We have provisions for people who have home conditions where studying isn't possible, can apply for special exemptions, and then they would live on campus. Other than that, we are saying, please do not be here. And there's not always a please involved. Can we stop them from moving to New Haven? No, we can't. But we're hoping that they won't. And it is true that they will still be enrolled students subject to our disciplinary regulations, and they still are students who have these kinds of relationships. So our ability to exert influence and pressure on them will still be present.
Mm-hmm. And
does that make sense?
It does.
We're all wrapping our heads around it a bit too.
Mm-hmm. No, that seems to make sense. I just want to make sure. So it's kind of similar to the question that I asked Albertus, right? Like, what is the mechanism with teeth for students who violate the community compact, what does that look like?
We have sort of gradations of teeth. So it starts with things like losing various privileges on campus for minor offenses, always having folded in conversations to try to correct the student and have it be an educational, we want to fix it. The ultimate penalty will be sending students home, telling them that they don't have access anymore. If we were to send a student home and then they didn't leave, that would be when we would move into more traditional disciplinary modes. That would fall under our defiance of authority codes. And so that would be, but I don't expect, we'll see. We don't know quite what to expect, but that would be, then we just get into our ordinary disciplinary measures of, we instructed you to do something and you didn't do it.
Our compact is online if you'd like to read it, and it's explicit in the compact that the student signs. It says, if at any point I'm unable to meet the commitments I am making to my fellow community members in this compact, I will remove myself from campus and complete the semester remotely. And then after that, it says, if I do not take this step myself, I understand I have forfeited the privilege of remaining on campus. And in order to promote health and safety, the university may take administrative action to prohibit me from participating in any in-person campus activities, including residency. So that's in the compact, even though there are these graded measures for people who maybe just didn't know how to do what they were supposed to do, and then we help them do it, if that's useful. But that's online if you want to read it.
Yes, thank you. I've seen it.
Okay.
Okay. Well, thank you, Mr. Chair.
Okay, Alder Winter.
Thank you, Mr. Chair. How did you determine to remove one class from campus? What went into making that decision? Like, why not 2 classes or 3 classes? Like, what is the standard for density?
I think one of the considerations, so one was, how do we de-densify the campus, and particularly our residences, which we think are likely to be more dense than off-campus residences, and how can we configure our campus, our residences, our bedrooms, so that we have one consideration was to try to get 1 student per bedroom. And so that we figured, because Melanie can speak in more detail to the configuration of our residences for undergraduates, but they usually have bedrooms and common rooms. They're in suites, and some of the bedrooms are doubles and some of them are singles. So that was one intention, and then I imagine the other intention was to give classes of students a consistent experience. So taking a whole class out, and a class that usually lives in the dorms as opposed to off campus would have the greatest chance of de-densifying the campus and having that group of students have a consistent experience. I don't know if anyone else wants to add to that.
I think that's right, Stephanie. I think it was, we wanted to obviously have room for isolation and quarantine housing. And so when you combine that with trying to give everybody a single, we also spent a lot of time looking at how many students per bathroom and what those ratios should be, and had a lot of input from healthcare professionals and such. But it was definitely an art and a science involved in it. But I think it worked out that by removing class at a time, that we could kind of give everyone those individual rooms and have good bathroom ratios and have enough for isolation housing. And so that's how we kind of ended up with this result.
What is the bathroom ratio?
I could speak to that one a little bit. So we're trying really hard to stay around 10 to 12 in the congregate dorm arrangements. We have some large dorms for our graduate and professional students. 10 to 12 students per bathroom arrangement. Stephanie, do I have that wrong or right? I'm not sure.
I think that would be the upper limit. That's in the congregate, the couple of congregate graduate dorms. I think most of the dorms have lower limits, but Don Filer could probably speak to that.
Yeah, well, the configuration of the residential colleges is such that, as Melanie mentioned, there are mostly these entryways. So it is often the case that there are very few rooms that are the same as any other room, very few entryways that are the same as any other entryway. And so the numbers vary wildly. And in many cases, there is a bathroom for 3 rooms. And in some cases, it may be a bathroom for 6. A lot of times there's a bathroom that will have 2 or 3 stalls in it. And other times there'll be a bathroom that has 1. So it really varies wildly. But between, with the emphasis on additional cleaning by our custodial staff, and then also the emphasis on the personal responsibility of the students to keep your space clean, and that includes the bathroom, we're pretty comfortable with the distribution of the bathrooms. And then the fact that the individuals are living in single rooms really accomplishes the primary goal, which, as Stephanie mentioned, is to reduce the amount of extended time that a person spends very close to another person.
And those are single rooms generally within suites of multiple rooms, correct?
Some are single rooms on in a stairwell, where there may be a cluster of 3 single rooms on the 3rd floor. But a suite might have in it a common room and 2 or 3 single bedrooms attached to it. That would be treated as a family unit. There are some suites that are larger, and those also are treated as a family unit when we talk about the expectations if there's a need to quarantine within the community.
Is there an upper limit on the number of rooms per suite? Like, is a 5-person suite a maximum? Is a 10-person suite a maximum?
Our very largest suites have 8 rooms. I don't know that they will all be filled in this configuration, and there are like 2 of them, I think. The Don's example of 2 to 3 bedrooms is much, much more the norm.
Yeah.
And I do want to emphasize the quarantining piece, that if one student in the suite were to be tested positive, everyone in that suite, because we're making the decision to treat them as family units, everyone in that suite would quarantine.
You mentioned that you'd been measuring compliance so far. How are you measuring compliance, and what does it look like?
I don't think we did say that. I think we don't have students back yet, so we have not been able to measure the compliance. I think what I did say, excuse me, I think I was talking about our experience with the laboratories, and we have actually had the experience of having them create safety plans, and they are given numbers to call if they think that anyone in the group is out of compliance and they need to report that. We have a hotline, and we also have a COVID resource line. But we're not necessarily, we were mainly measuring who was allowed on campus and who wasn't. So we do have because we only wanted those people who were permitted to be back on campus during our gradual reopening to be on campus. So supervisors will get a notification if somebody has used their card swipe, so they track the card swipes to be on campus. That's one thing that we have tracked. We also have an app for symptom monitoring that some of the labs are using. Others do the manual symptom monitoring, where employees are supposed to confirm that they don't have symptoms when they come in. So we have multiple ways to do that. So that I was referring to. I'm sorry if I was not clear.
Will students be using an app like Albertus Magnus mentioned?
There are a number of different possibilities that students will have. They will certainly, Melanie can speak to some of those that are traditionally used. In terms of our efforts to help people comply with testing, we're anticipating a couple of tools. One of them is MyChart, which is the patient portal for our electronic health record. And students will be able to actually schedule their test appointments through MyChart, and they will receive all their results through MyChart, and they will get reminders about appointments through MyChart. And we're also developing some other apps that will help to support the very regular testing schedule and nudge people to test to schedule their results. We do have reporting mechanisms that are just at the starting phases right now, because we're just starting to do the first set of required tests, which are kind of arrival tests for graduate students. And we do have the capacity to generate reports that we send back out to the graduate schools to let them know who of their students have indeed followed through, and to give them an opportunity to nudge those who have not. So we're evolving those reporting mechanisms, which will be more robust by the time graduate students the undergraduates get here.
What level or what percentage of the student body will be tested weekly?
All of them.
Everyone.
All of the, yeah,
All
all
the
of the undergraduates.
Okay.
And the in-residence graduate and professional students.
Thanks. What were the results of the testing of asymptomatic population you mentioned?
So at this point, we have tested, I think, close to 3,000 asymptomatic individuals as part of the Return to Campus effort. And so far, we have 7 positive cases. So it's as Stephanie pointed out, it's a 0.2 to 0.3%. I think it's like 0.23 or something. So very low and very similar to what's being seen in other New Haven populations. The Yale New Haven Hospital tested close to 12,000 healthcare workers who you'd think might be more inclined to have higher rates of exposure, but their rate of positivity was also quite low at about 0.24%. One more thing I'll add, we are planning a public-facing part of our website where we will be sharing that data. And it will both include Yale-based data from our asymptomatic screening, as well as data from our Yale Health population of 45,000 individuals who are both members of the campus community, but also many members of the wider New Haven community. So we'll be sharing data about the rates of symptomatic positivity among that population, so that people will have the ability to look at that information if they would like to.
One more question. What would cause you to shut down a facility or a residence? You mentioned that you had been considering that possible scenario.
Yeah, I think, we have a number of metrics that we're going to be tracking, and we have a model, an epidemiologic model that it has informed our testing strategy. And as we start the academic year, in particular this regular surveillance testing, we'll be watching very closely to see whether our rate of positive tests is within the range that the model predicts is acceptable, or it seems to be climbing out of that range. So I think we'll be following certainly the number and the rate of positive tests. We'll also be keeping track of the number of individuals who are in isolation or quarantine, because that capacity is a critical part of our ability to respond to the epidemic. We'll also be watching closely certain community metrics like hospitalization at Yale New Haven, overall percent positive of tests as has been looked at locally and nationally. Happily, right now at Yale, all of our testing, we're at under 1% positivity overall. And, you know, places like Florida and Texas are, you know, exceeding 20% right now, which just emphasizes how lucky Connecticut is right now. Not luck, because we're something special, I'm sure, but we're in good shape, but watching closely.
Thank you. Thank you, Mr. Chair.
Alder Roth.
Thank you, Mr. Chair, and really thank you everyone who for all your presentations tonight and all the thought you put into things in advance. I do have a few questions. I'm not sure anyone answered how long test results will take. So if you could answer that. And then a second part to that is the reason that graduate students living off campus are not being tested because you wouldn't have capacity to test them and results would take too long to come back if you also were testing that population?
So our expected turnaround time for testing is 24 hours from the time that it arrives in the lab. Now we've talked with a number of lab vendors, and we put out an RFP, and that was one of our primary considerations. And we feel we've made a good choice, and that the vendor we've chosen is somewhat insulated from some of the national pressures on commercial labs. But everyone has to know that there is a degree of uncertainty in this environment, and previously completely stable environments have suddenly learned that they're lacking some vital piece of equipment that allows them to run tests where there's only one vendor worldwide. We don't think that that's going to be the case for this lab, but you know, we're just watching. Nobody can be completely insulated, but 24 hours is our expectation. And the reason that we're not testing graduate students who live off campus is that we don't feel that the risk that they face reaches the level of risk for undergraduates in particular and others who are in congregate housing. And that even though you may have roommates in an apartment, that's not the same thing as having a large group of young people who are with each other all the time and may not be quite in a position to follow recommendations about social distancing that people who are in their 20s, older 20s, may be able to. So it's not a capacity question. It was really an effort to focus our resources on the area of highest risk.
Thank you for that. I know I send out a newsletter and I have some graduate and professional students on it, and I will tell about city testing sites, but it might be helpful if the university also shared information about sites within the city that people can go get tested at. A few more questions.
Alder Ross, we do offer testing to those individuals. They're not going to be on a weekly testing schedule, but if they have concern about an exposure, if they have any symptoms, they have access to testing. If they are worried and they want to test more often, they can. We just don't recommend it.
Okay, that's actually really helpful to know. Thank you. I guess I did listen into the Yale town hall last week, and it was interesting to hear there was a question raised about the Yale shuttle and concerns about that. And it was said that one way to perhaps address crowding was to reach out to the city about making some roads more bike friendly. And it would be great to hear a little bit more about that thinking.
I don't think there's a specific plan on that. I think it was, you know, an idea that we're certainly happy to continue to have further discussions on. But you know, that I think it was just a thought that if we're trying to get people outside of shuttles and confined spaces, that, you know, one way to think about it could be through expanding bike lanes, and, you know, we'd be happy to have those conversations with the city.
Thank you. No, I think those would be productive conversations, both for this situation and for the future. I think about the convergence of social justice protests and COVID happening and students returning to campus and perhaps gathering for protests. And is there a plan for, I mean, it sounds like for undergrads that you're doing that testing. What is your thought about with those protests, how testing would work right after that, contact tracing or things of that nature?
You know, earlier in June when the protests were happening, we did offer provide testing to individuals who had been involved with the protests and were concerned about possible exposure. So I don't see any reason why that would be any different. We would continue to offer that. We are also asking people to really be careful, and obviously people did, because we really didn't have, there wasn't a big outbreak that resulted, even though it was, there was concern about it, but just to do the best you can to social distance and mask under the circumstances.
Yeah, no, I appreciate that. I think a lot though about the fact when those protests happened, the numbers had already started getting lower. And if protests happen and the rates are still high in other states and the protests involve people from a lot of other states being really close together, that's concerning. So just something to keep in mind. Just two more questions. One, Yale Station, which is the post office I go to when I need to go to a post office, is a really crowded space. And students go, people who are not students use it. And I'm just curious what conversations you've had with the US Postal Service about sort of how to set up that really crowded space in a way that allows for social distancing, because there's always sort of a very long line as is.
And as you stated, that is run by the US Postal Service, and we have reached out to the Post Office General to advise them that they really need to improve the situation there and to create social distancing spaces and markers and what have you. Unfortunately, we're only in an advisory role. They do operate it. So I'd encourage the city to have those conversations as well. But we certainly are encouraging them to practice social distancing modeling and behavior and guidelines in that building.
And thanks for that. I'm curious, when you reached out to them, I mean, did they seem receptive and say, we're on it, we're putting sort of markers down every 6 feet, or what those conversations what the reaction was?
My understanding is that they seemed receptive, but we'll have to see if they actually, I don't think they've necessarily done it as of yet. I don't know, John, if you have any other details on it, but.
Right, so we haven't gotten the concrete set of answers from them on how they're planning on doing it, but my sense is that New Haven Station, Yale Station, and other Postal Service locations are all going to have the same kinds of protections and social distancing in place. So I would imagine and expect that they would do the same. I can offer a couple of other bits of information. So last year, to address mostly package distribution around campus for undergraduate students, large numbers of packages, as you know, come to campus. And so taking the pressure off of Yale Station, we've worked with Amazon to place some Amazon locker distribution locations around campus, which should help our undergraduate students maybe have less of an occasion to go to the Postal Service location. So there are some steps that we've taken that should help alleviate a little bit of the concern, but at the end of the day, the postmaster is responsible for, as Lauren said, for social distancing, markers, signage, and so forth in those locations.
Great, that's really helpful actually to hear about the package location. I guess my final question actually is for the Mike Piscatelli and Becky Bombara. I'm curious if you have any sense of what the governor's thinking about reopening bars. I have a lot of concerns about if bars reopen as students return. I think that's a situation that you're going to have people crowded inside without masks. People may sign that contract, but I have a hard time believing. I think people may still be tempted to go out at night and see their friends and be in the same location as a lot of people from across the city. We've seen it happening across the country. And I think that concerns me as much as I want the small businesses to be able to operate. I think it could backfire. And so any insights, if you've had conversations or know of conversations about the timing of bars reopening with students returning to campuses, that would be
So bars were part of the anticipated phase 3, which had been signaled to begin in July. The governor has paused phase 3 due not to local health conditions, but the national trends. So as we continue to monitor the national trends, I don't see phase 3 going forward until those national trends are more favorable. We will continue to monitor that. One thing to note that while bars are not open, many of our restaurants do have liquor licenses. So we are looking at that. That's one of the reasons we plan on setting up that social scene meeting, or so to speak, so we can help reinforce to those restaurants what the expectations are, not just for the students, but for them as well. You have seen our task force go out throughout the city on random inspection schedules, which we do plan to continue through the summer and through the reopening of universities. You'll likely see a shift in hours when that occurs. So it's definitely on our radar, and we'll continue to focus on that and support however we can. I don't know if you have anything to add, Mike.
No, I think everyone on the call shares, on the Zoom shares that same concern, right? We've got a good thing going. People have worked really, really hard. Many more people are coming into our community. And as Becky said, we traditionally don't have tavern licenses. We have restaurant beer and wine, restaurant liquor licenses. We're going to work really hard with that community of proprietors to make sure that we don't have the same types of concentrations, just in a different type of setting. Backyard party, on a corner sidewalk, that sort of thing, or in an actual establishment.
Great, thank you. And again, truly, thank you to everyone who spoke tonight. I know it's getting late, and I appreciate all that you shared.
Alder Sabin.
Thank you, Mr. Chair. My first question is just, I know that you may have mentioned this before, but I just want to get confirmation that all the undergraduate students at Yale, whether they're living on campus or off campus, are going to be tested weekly. Is that right?
All of the undergraduate students at Yale who are in residence, so the juniors, the seniors, the first years in the fall, are going to be tested. We are at the moment not making plans to test students who come back, even though we've asked them not to come back. They will still be Yale students, but they will be studying remotely. And we're trying to set up as many boundaries as possible as we can between them and the rest of our campus. That's a situation we're just going to have to watch.
Thank you. And could you talk about how you're planning to conduct that testing of maybe 3,000 or 4,000 people on a weekly basis? Is that going to happen over the course of the week so that there are not long lines at Yale Health or wherever these tests are going to be conducted?
Yeah, I can speak to that. So what we're developing is a network of a total of 14 test sites, including one that is affiliated with the Yale Health at the Prospect Sachem Garage behind the Whale. But then I think a total of 12 or 13 that are in residential colleges. So they will be either a single college or two colleges combined and sharing a site. We wanted to make testing as accessible to students as possible so that they would have an easier time complying with the expectations. The test sites will be staffed. People will do an observed nasal swab, and it's not the deep one, it's the front one. And it should just take 2 or 3 minutes for people to get through. We're being very careful about the traffic flow and working very closely with our colleagues in environmental health and safety to ensure that we minimize any risks associated with the test sites. The risk is relatively low because people are asymptomatic and the test that's being done does not generate a lot of aerosols, but we're taking a lot of precautions. So All of the students, when they arrive, will be assigned a testing schedule and a testing location, and we are scaling to accommodate the students on campus. We don't yet know that exact number, but our intention is to meet that need plus some buffer so that people who miss their testing can get in, and so that we can accommodate unexpected flux. It's a big undertaking. There's a lot of tests.
Yeah, I'm sure. That's great to hear. I had another question, which was, what happens if a student who's living off campus tests positive? Are you expecting that they're going to be quarantining in their room and that everybody else in their house who may have interacted with them within the prior 24 hours will be quarantining as well? Or is there some other provision? I'd love an explanation about that.
If a person lives off campus, they'll be asked to self-isolate in their residence, and will be given guidance about how to do that within the context of an apartment, say. Typically, in that circumstance, the apartment often does function as a family unit, and those others in the apartment will be direct contacts, close contacts, who will also be asked to quarantine. That doesn't mean that they should all mix together, because the individuals who are not known to be positive will be offered testing, but they will not be moved to campus, for example, to an isolation space on campus. We're going to keep them in their residence.
Got it. And then my last question is about Yale security, YPD, and HPD, whether you have thoughts about how various security or public safety operations will be conducted with regard to any sort of parties that are happening off campus or on campus. If there is some large gathering of undergrads off campus, does the university plan to have any interaction with that sort of an event, and in terms of trying to shut it down, and what plans do you have to make off-campus social life as safe as possible and within the guidelines?
I'll jump in on that one. I mean, you referenced briefly on campus, and on campus a party would be shut down by the dean of the residential college or other leadership in that college community. Off campus becomes trickier because it is not our space, right? So they are our students, but they're not, and they could be held responsible for violating the compact that they've signed, which includes both not hosting a party, but also not attending a party that exceeds the safety guidelines, either in the total number of people or in the social distancing possible. In an ordinary year, those parties tend to be reported by neighbors and broken up either by the New Haven police or the Yale police, depending on where it is, and, you know, traffic patterns and things like that. And I would imagine that those reports will come in even more quickly in this context. When that happens, we are aware that our students were involved, and we can reach out. Normally, we would be reaching out to provide guidance about good neighborly behavior. In this context, this year, we'll be reaching out to talk to them more seriously, or just as seriously, but also in addition, about the public health challenges and the community compact there.
Excellent, thank you. I think that's going to be something to monitor going forward, to make sure that there's nothing happening on campus or off campus that will endanger the student body and the community at large. Thank you, Mr. Chair.
Thank you all. I just want to take note of the time. If there are any additional questions from members of the committee, I'm just going to kindly ask that we provide that to staff, and then we can forward that to the appropriate university, mainly probably Yale. But you know, I just really want to thank you all for your time. This is really, and it was a kind of a short turnaround, and I realized that as well. But due to summer schedules, unfortunately, it had to be this way. But I would like to acknowledge Alder Roth and Alder Sabin. Thank you for introducing such a crucial point for this committee. And again, we'll continue the partnership that we've long had with universities like Albertus and Yale. So at this time, you all are members of Yale. You are dismissed. And I will keep the meeting going. The chair will entertain a motion to close the portion of this hearing.
I move to close the public portion of the meeting.
Thank you. Do I hear a second?
Second.
Second.
Yeah, we're all going weary, so all in favor, say aye.
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 Oppose, opposition, abstention. Okay. We are now in the closing of the public portion of this hearing. We have 3 grants that are on the table. The chair will entertain a motion to move those grants in an expedited fashion to unanimous consent and discharging it tonight.
So moved.
Mr. Chair, is one or the other. Are you if you're going to discharge, you do not need to vote on them. That will be an action that the board will take at the August meeting to discharge them for the committee. You want to give them unanimous consent, the committee can vote on them and send them UC. Those are your choices.
Well, I doubly want them approved and quickly. So, which one is the fastest route?
The one that allows you the most flexibility is allowing the board to discharge the committee from considering them.
Okay. We will rewind that motion to discharge the items, all 3 or 4 items to the 3 items to the full board.
Mr. Chair, I make a motion to discharge items 1 through 3.
Do I hear a second?
Second.
All in favor?
Aye.
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 Opposed, abstention. Do we discuss at this point? Or no? We
The
missed
floor is
it.
open. Yeah, the floor is open. If you have something to say, you can call on if you wish.
Okay, anyone have anything to say? Okay. Chair will entertain a motion to adjourn.
So moved.
Second.
Hearing it moved in second, all in favor?
Aye.
Opposed, abstention. Good night, folks.
Thanks. Good night.
Thank you. Thank you, Alders.
Thank you.
Thank you.
Good night, everybody.
I was gonna ask him about that joint committee notice.
Your volume's kind of low, Mick. Your volume's kind of low.
Volume's low?
Yeah.
I don't know if I have
It's all right. I can hear you. It's just very low. But go ahead.
I was gonna ask him about the joint committee notice, if that's what they wanted.
Gotcha. Okay. We'll follow up with it.
I mean, we have time, we'll work on it tomorrow, but.
Yep.
I mean, is that
Yep.
basically what
I think you're right. I think,
A workshop to discuss.
yeah.
the mayor's- I don't know, maybe they want a full-blown.
Proposal.
Agencies, I don't know.
I don't think that their intent. Their intent was to look at what the proposal was and then make recommendations to changes.
Yeah,
I think that's what they wanted to do.
so you want to keep it kind of low.
Yeah, I think they want to have a 4-hour meeting about why I got 10,000 as opposed to 15.
That's why I wrote the
Or
notice the
to-
way it is. It says, you notice it says to review them, not discuss them. But I'll check with them again tomorrow.
Yeah, they do intend to be able to amend them. So we may want to add review and make review and make recommended changes. They don't have to necessarily vote on them. In terms of at the committee meeting, we should include in the notice that they're going to make recommended changes.
Make recommended changes. Well, but recommended by who?
But committee. Well, they may get it from other, but the committee's going to make the recommended change. The committee's going to recommend changes.
To review and recommend possible changes. Right?
I would say changes. I can guarantee you they're not going to just accept as is unless the administration is going to do some political work between now and then. And considering Gizzy just sent me the draft application, I don't anticipate that there's going to be enough time for the administration to do the political work that would be necessary in order to get this to go through with no changes. So just say recommend change. If there's zero change, that's fine.
Because this doesn't have to go back up to the full board, does it? It just needs to be.
No, it's only going to, correct. It's only going to end up there if it is a problem.
Yeah. So it's like a brokered, package that they're not
Yep.
taking public testimony on.
Right.
Yeah. Okay. Well, I'll revise the notice to say review and recommend and send it back out to the committee tomorrow and see whatever. I mean, if it's a workshop, it can be posted in a few more days. Anyway.
Right. Well, thanks for hanging in there. I know it's late over there, so
Doesn't really bother
thanks for
me.
hanging in there. And
Not a problem because, time doesn't have that much meaning anyways over here.
fair enough. All right. Well, cool enough. How close are you to the loud noise for the nightlife?
This is right in the middle of the city, but it's in a courtyard that's surrounded by apartment buildings. Like this apartment house, like it's a 4-unit apartment house, and
Yes.
these people have owned it for their great grandfather built it over 120 years ago. So
Gotcha.
all these apartment buildings, like big Soviet style apartment buildings, were built all around it. And they keep out the noise.
Gotcha.
And pollution. It's pretty cool. You actually get back here into the courtyard. You go through a tunnel through one of the Soviet apartment buildings.
Interesting. Okay.
Then you go through that tunnel and you're on to one of the main streets in the city. Like that's where
Just like that.
the buses are on it. The electric trams are on it. The taxi terminal is here, the airport bus terminal is here, and the main train station is just a couple blocks away. So, I mean, it's just massively busy, but when you're back in here, you can't hear any of it. It's pretty cool. But it would be like just walking out onto like Lexington in downtown, Manhattan.
Right. Right. Well, cool. Well, all right, sir. Well, have a good evening, and we'll be in touch. Well, Daryl may.
3 in the morning and half of the places will be open.
Wow. Okay. All right. Yeah. Yeah. Cosmopolitan, huh?
Pardon me?
Said it's the cosmopolitan city, huh?
Yeah. I think even more than New York because Europe is used to being open like that. Just like the density needs. You could get a haircut here at midnight because they have to be open that late to serve the amount of people that want a haircut. So different from New Haven.
International drive. Got it. Yeah. Well, yeah, it's more, like you said, more like a New York, LA, Chicago type take place.
Yeah. Yeah, I've never really lived
Well,
in
very,
before.
yeah, it's a it's nice. You get spoiled when you live in places like that because you can actually scratch an itch anytime, and so you get spoiled because you can just do something, you know.
Yeah. Yeah, and all the shopping is within walking distance, so you don't need to go in a car or anything to go buy stuff.
Yeah, it's really great. One of the great things about a lot of these old cities too. Uh, someday, I'm gonna figure it out instead of building roads to nowhere, so I can put a house. So I have to drive to get anything. We'll figure it. We'll figure it out.
Yeah.
But all right, sir. Have a good one,
Good night. Thanks.
and we'll talk. All right.